One of the most challenging and critical pieces of proposed legislation is now the home stretch of the lawmaking process. The reconciliation and integration of the approved versions in both higher and lower chambers of Congress. PTV correspondent Joanna Cruz on the thorny issues of a nationally mandated health insurance for all that range from physician and provider of choice, scope of coverage, preventive services and pre-existing medical conditions, and the source of funding, among others, in this report.
After the Senate approved the Universal Healthcare Bill on October 10th this year, the bicameral committee is now fleshing out the proposed reconciled version of the two chambers of Congress. One particular issue that concerned the Senate in today's hearing is the possible threat some provisions could pose to the PhilHealth's resources, the government agency mandated to finance health services under the bill. The bill states that direct and indirect PhilHealth contributors alike shall receive the same and equal benefits.
If you were a self-employed, why will I pay now? Walang employee-employee relationship to. Walang kaltas-sweldo to. Hindi na lang ako magbabayad. Libre din naman yan eh. But if you incentivize it, then chances are you will continue to pay.
As defined in the bill, direct contributors are those who have the capacity to pay further contributions or premiums, such as working professionals. Premiums of indirect contributors, on the other hand, will be subsidized by the government. As such, senators are seeking alternative sources of funds apart from medical funds from PAGCOR and PCSO.
Ang ano ko rito, on the third and fourth year onwards, we would need additional sources of revenue. Kaya nga I'm proposing the tobacco tax to be increased.
Revenues are expected to reach 45 to 50 billion pesos once tax on tobacco products is raised, according to Senator J.V. Ejercito. Meanwhile, the House remained firm on its stand to vest responsibility on the country's health insurance program to give equal medical services for all, albeit it insisted that it respects the Senate's stand. The Senate eyes delivering the Universal Healthcare Bill to the Malacanang hopefully before December, but it assured that it would not make rushed decisions just to approve the bill. Joanna Cruz for The Nation.